There have been some genetic therapy clinical trials for Sanfilippo. For my kids, specifically type C, there has not been yet.
Correct.
Of the A and B types where there have been clinical trials, the first thing that comes to mind is the money. Funding is always a huge problem in Sanfilippo world because the population is so small. What have been some of the challenges that have prevented major progress in these potential solutions?
What I'm going to speak to here actually applies to a lot of rare neurogenetic disorders and neurometabolic disorders. I think Sanfilippo has taught us a lot of these lessons because of the trials that have been tried in this group. I think the most important thing that I've taken away from the trials, and something that the community as a whole has worked so hard to do, is that for any disease in a rare disease population where you're trying to show that your drug, your gene therapy, whatever it is, works, you have to understand the disease first. You need what's called natural history data, and that is crucial in the rare disease space. I think in Sanfilippo, one of the things that, there's been so many amazing efforts to define natural history, which we can speak about, but it's really a hard thing to quantify. So what natural history is basically what happens, or what's the typical course of progression of these diseases in kids or patients. So, at what age do most children with Sanfilippo learn to talk and walk? And then what happens after that? So understanding what normally happens, what the natural progression is of the diseases, and what the variability is in that. Because there are absolutely children who are more severely affected early on, and some children who have what we call attenuated forms that progress much later. And there's been a ton of work to try to define this for Sanfilippo. It's been beautiful data. And I will say that we have learned from the trials, having this data is so important, because unlike, let's say, developing a new drug for high blood pressure or developing a new drug for all these other more common, often adult onset conditions, most of these trials do not have a control arm. That's not true for everybody, but there's not a direct comparator at the same given time, right? That's in general for ultra rare pediatric diseases. That's not the way trials work, because there just aren't enough patients out there. And so you have to compare how well your drug is working to what we think the typical progression of this disease is. And so you have to define that natural history. And that's been so important for Sanfilippo and for other rare diseases. And I will say what's hard for Sanfilippo is that the natural history data is essentially all what we call neurocognitive data. Those are the symptoms that we measure. So that is a child's ability to learn, a child's ability to do different cognitive tasks, functional tasks, all those measures of the brain. And that is very tricky to measure reliably in children over time. And it makes the endpoints, or the things that show us that a drug works in Sanfilippo, really difficult, because it's not just, does their liver get smaller, or does their blood pressure go down for a blood pressure medication? It's what does their development look like relative to these natural history controls? It is more difficult to show robust differences, because as a parent, as a physician, we all know there are days that our kids just don't want to participate in whatever testing is being done. And there's good days and bad days. And so anytime you have these endpoints that are so dependent on participation of a child, are difficult to obtain, which is the things we measure in Sanfilippo, it makes it hard.